Hey, hi everyone. Welcome to our serotonin toxicity virtual drawn doodle simulation demonstration. Let's begin.
So for this simulation, I, Aaron, will function as the team leader. Let's assign the following other roles. So let's do ABCs for roles, or airway, bedside, clerk, as in tasks like IV or meds, as well as scribe. So airway, can that be you, Connor? And bedside, can that be you, Will? Thank you. And clerk, can that be Josh? And scribe Arthur, please.
And I'll be the narrator. All right, folks, are you ready?
Yeah.
Excellent.
Yes.
Yeah.
Ooh, you are at an electronic dance music festival inside a medical tent. The 20-something-year-old male patient is brought in by security. Friends said he ingested MDMA, cocaine, and alcohol. The patient is very, very, very sweaty, and you can see depicted here by these drops of sweat, and very agitated as well. Lines of agitation here. The patient is thrashing around and at risk of hitting his head. You folks enter the scene.
This patient seems like a danger to themselves and others physically. We will need some chemical sedation. So let's make sure we have one person on each limb and someone protecting the head. So can I get you, Connor, on the head? And then Will and Josh, can I get you on each arm, please? And then a scribe, Arthur, can you go on the legs? Is everyone in place and ready? Josh, please drop 10 milligrams of midazolam and administer it intramuscularly.
Okay, I'm drying up 10 milligrams of midazolam.
Okay, everyone, let's keep the patient still.
Yes. Okay, I got the legs here.
Okay, I have the midazolam ready. Sharps up, everybody. 10 milligrams of midazolam is in.
Copy that. 10 milligrams midazolam I am given.
Okay, the patient is successfully sedated.
Great. Let's get some initial steps done of starting an IV, getting vitals, and hooking up the patient to the monitor. Josh, please start an IV, as well as Will, please get a set of vitals and attach the patients to the monitor.
I'll get started on the vitals.
I'll try for an IV.
Okay, your IV goes in successfully.
The IV is in, 20 gauge in the left AC.
Got it. 20 gauge IV in the left AC.
Okay, see you're putting on the monitor leads right now. I will update your vital signs.
Just waiting for the vitals. All right, folks. We have a temperature of 38.78, heart rate of 150, respirates 36, the blood pressure is 130/80, and they're saturating 95%.
Thank you. Will, please go through a primary survey with the ABCDE acronym, sharing out loud with the team what you find.
So first I'm going to assess the airway for the patient.
The airway is patent.
Next, I'm going to assess their breathing.
There's no increase to the breathing, and the lungs are clear.
Next, I'm going to move to their wrist. I'm going to check for a cap refill at their fingertips, and then I'm going to have an assessment of their skin.
The cap refill seems brisk.
And then when I assess their skin, I'm going to stick my hand in their armpit and to see if it feels sweaty or not.
Yeah, it is quite sweaty.
Next, I'm going to just assess the patient's level of consciousness. I'm going to ask them if they happen to know where they are.
They're quite sedated from your medication.
Right, decreased level of consciousness. Next, I'm going to try and see if I can assess their reflexes.
Their reflexes are quite brisk. So on the knees here, they're hyperreflexic.
Okay, and then I'm going to check to see if there's any rigidity in their lower limbs.
In the limbs, they have mild rigidity.
And then any clonus to their feet.
There is some ankle clonus bilaterally.
And then checking their pupils, I'm going to try and swing a flashlight between their pupils.
When you check the pupils, they are reactive, but the eyeballs are quite big.
Okay, and then next I'm going to roll them over, kind of examine from head to toe on their front side and their back side to see if there's any signs of trauma.
No signs of trauma.
Okay, great. Thank you. So let's recap quickly. So far, we have what looks like a 20-something-year-old male who ingested MDMA, cocaine, and alcohol that has an overall picture of serotonin toxicity. Features of serotonin toxicity include cognitive changes, so the agitation, autonomic changes, the increased vital signs and big pupils, and the neuromuscular activity, which is the hyperreflexic knees, the leg rigidity, as well as the ankle clonus. The patient came in severely agitated. We did give him 10 milligrams of midazolam IM. We'll need to watch out for worsening neuromuscular activity and hyperthermia. As primary survey adjuncts, let's get a 12-lead ECG and a blood glucose. So Will, can you please get an ECG? And Josh, please get a glucose.
I'll get us a 12-lead ECG.
I'll work on getting us the blood glucose.
So your 12-lead ECG comes back and it shows sinus tachycardia. You don't see any other remarkable findings.
The ECG is sinus tachycardia. QRS, QTC, normal.
QRS and QTC unremarkable on ECG.
I got the glucose back and it's 5.3.
Glucose 5.3.
Team leader, would you like to start a liter of normal saline?
Yes, thanks for that. That's a great idea. The initial temperature was 37.8, which was temporal. I suspect that if we had capabilities to do a core temp, it would possibly be even higher. So let's start hydrating the patient with some cooled IV fluids. 1 liter, please.
Yes, I'll hang 1 liter of normal saline taken from our cooler with ice.
Thank you. We may also want to start collecting some ice and bring it to the bedside.
I have some for your hands right now. I can go grab some ice so that Connor can stay on the airway and that Josh can give meds as needed.
Thanks for grabbing the ice, Will.
Okay, so we are starting 1 liter cooled NSIV now. Got it. And we're grabbing some ice to bring to bedside.
I can start a second IV too if you'd like, Aaron.
Sure, thank you.
I got one in now.
Second IV in.
Okay, yeah, your second IV is successful. The patient is starting to move again after the IV poke and is slightly getting more agitated.
How's our patient doing now, Will?
I'll do a tox exam again.
So you see the eyes bounce a little, rhythmically back and forth like a ping pong ball.
Looks like we have ocular clonus here.
And they're also clenching their jaw.
The jaw's getting really tight and they're clenching.
I'll check the legs for hyperreflexia, rigidity, and ankle clonus.
The limbs are now getting more rigid. The reflexes are less hyperreflexic now since the limbs are becoming stiff. The ankle clonus is now sustained when being checked.
Okay, so ocular clonus, trismus, and increased leg rigidity, and sustained ankle clonus. Got it.
All right, team. This patient's neuromuscular activity is getting worse. Let's get benzos on board for sedation, for the agitation, as well as for the relaxation of the muscles. Josh, now that we have an IV in, please give midazolam 5 milligrams by IV for the agitation and increased muscle activity.
Okay, 5 milligrams of midazolam is drawn up. I am now giving it IV.
Midazolam 5 milligrams IV given for agitation and increased neuromuscular activity.
The team leader has their hand on the patient's foot and finds that the foot feels very warm.
You know what? Let's reassess the vitals now, too. Will, can you give us an updated set of vitals, in particular the temperature? This patient's foot is feeling really warm.
I'm just updating the vital signs live for you folks right now, and those should be updated.
So taking the temperature, 38.5, heart rate's 143, the respirate's 24, blood pressure's 140/85, and the saturation is 89% on room air.
Okay, so the temperature has increased to 38.5 and the saturation has decreased to 89.
I'll put the patient on some nasal prongs to support oxygenation, and I'll also do a head tilt chin lift. Maybe the midaz sedated the patient too much.
Okay, as you put on that oxygen, you are 95% on 5 liters per minute.
Okay, great. Thank you, Connor. The patient is still very warm. We need to cool aggressively. Let's prioritize getting bags of ice on the cheeks, palms, and soles, as studies have shown this is more effective than neck, armpits, and groins. If that doesn't work, we'll just have to be more aggressive with cooling and pack the patient with ice like a fish.
Okay, I'll start with the cheeks, palms, soles for ice. I'll tape some ice around the palms and soles.
I can help with the ice too. I'll do the soles of the feet. If Will, you do the palms of the hands.
Sounds like a plan.
I'll also hold some ice by the cheeks.
All right, beginning cooling to cheeks, palms, and soles.
Despite all those efforts, the temperature rises to 38.9 degrees Celsius.
The temperature is still going up. We've tried cool IV fluids as well as midazolam to decrease muscle activity as a strategy to prevent overheating. And we've also tried icing. We'll need to go more aggressive with the cooling, so let's pack the patient with ice like a fish.
Okay, giving more ice all over the body.
We'll also appropriately remove clothing to uncover skin.
Okay, great. And let's also check our neuromuscular leg exam again and keep a close eye on the temperature.
Okay, I'll reassess the legs and temperature.
The lower extremities are now becoming so rigid that there's no more ankylosing inducible, and the temperature rises to 39.4 degrees Celsius.
The temperature is now 39.4. That's quite high.
Okay, temp 39.4 and legs even more rigid.
This patient has worsening leg rigidity and worsening hyperthermia, refractory to all our efforts in muscle relaxation as well as external cooling. We'll need to paralyze the muscles to stop the rigidity and overheating from muscle activity. Because we're doing so, we will paralyze the ability to breathe. So we'll need to capture the airway. Josh, please draw up ketamine 100 milligrams and rocuronium 100 milligrams for intubation.
I'll draw up ketamine 100 milligrams and rocuronium 100 milligrams.
I'll add a non-rebreather over the nasal prongs that I already have to better pre-oxygenate the patient. I'll get a second oxygen tank for the non-rebreather.
Okay, I'll grab the intubation equipment. Arthur, can you please oversee the patient for now as I do that?
Yes, I'll cover for you for now. Do we call EMS?
Oh, oops. Good call. Thank you. Will, can you pop out of the recessed area and tell medical operations to call EMS, please?
Will do.
Your team calls EMS, and your team leader prepares for intubation and performs the intubation successfully. EMS arrives, and the patient is transported to the hospital. Another life saved!
Woo!
Woo!